All right. Hi, everybody. It is now 2 minutes after, so I think we're going to go ahead and get started. My name is Brenna Rabel. So welcome, everyone, to another MMS info session. As you probably know by now, these sessions are offered under the CMS Measures Management System contract, which is led by Battelle. So I oversee education and outreach on this project. And today's session is on the topic of recent updates to some key CMS resources, specifically the new Care Compare site, which is combining and replacing a suite of setting-specific compare sites, and the MMS blueprint, which has been redesigned to be more user-friendly. So you're first going to hear from Nathaniel Mudd from CMS, who's going to walk you through Care Compare, and then my colleague Jennifer Brestrom, along with our MMS core, CMS's Kim Rawlings, are going to describe the changes to the blueprint. And then at the end, I'm going to share a little bit of information about a new Quality Measures 101 document before opening the lines up for discussion. So as you know by now, these info sessions are part of an ongoing effort to engage measure developers and other stakeholders in quality measure topics. That's an effort that also includes a series of newsletters and bulletins, along with special announcement emails, public webinars, and routine updates to the Measures Management System website. I think you all probably know by now that, as with last year, these sessions are being held bi-monthly rather than monthly, but are still going to focus on a wide range of topics related to quality measure development. So before we jump into the presentation, I just want to cover a couple of housekeeping items. The first is that today's session is being recorded. Second, all participants will be muted during the call. We will have 2 opportunities for Q&A, once after the presentation on the Care Compare site, and then again at the end, during which all the lines will be unmuted for questions. That said, if we get a lot of background noise during those, we will remute the lines and just invite questions via the Q&A or chat feature in WebEx. And then finally, the presentation slides from today's session are going to be posted to the MMS website, and then we will also be posting a recording of today's presentation on the CMS YouTube page. It'll be linked next to those slides on the resources page as well. So here's just a quick agenda for today's presentation. As I said, we're going to start with Care Compare, then an overview of the redesigned blueprint, and then finally a walkthrough of Quality Measures 101. And so with that, we can switch slides, and I'm going to turn it over to Nathaniel.
Hi, everyone. Thanks for joining us, and I'm excited to share some information today about some upcoming changes to the Medicare Quality Compare tools. We're making some significant improvements to the Compare tools to better help people with Medicare find information about healthcare providers and services. This is part of the eMedicare initiative. We wanted to take this opportunity to show you the new Care Compare on Medicare.gov. This was launched in early September, and it will replace the legacy quality tools when they sunset at the end of this year. The 2 tools we launched to support the eMedicare initiative are Care Compare, which will be on Medicare.gov, or is on Medicare.gov for beneficiaries, patients, and consumers. And the second tool is the Provider Data Catalog, PDC, which is for data-minded stakeholders like academia, researchers, and parts of the healthcare industry. Care Compare, which we'll be demoing today, is a redesign of the current Quality Compare tools. Care Compare will offer patients a more streamlined compare experience, improving their ability to find information about doctors, hospitals, nursing homes, and other healthcare services. And it will turn into a single interface on Medicare.gov. For those that are familiar with the current quality tools, there are essentially 8 different tools that if a beneficiary needs to navigate, they have to jump between a bunch of tools that have different user interfaces. The other tool that we won't be demoing today, but one I want to mention, is the Provider Data Catalog. And this will be replacing data.medicare.gov, which currently serves as a repository for all the data that's displayed on the Compare tools. When it's launched, or you can go there today, it's at data.cms.gov/provider-data. I can put that in the chat after this. And again, while Provider Data Catalog is important, I'm going to spend most of this presentation talking through Care Compare. So the vision of Care Compare is really what I mentioned earlier. Over time, we had built different tools for different compare settings. And what we found from user research, next slide, thank you. What we found from consumer research was that this was often pretty jarring for a beneficiary who oftentimes want to jump around to different settings. The other thing that has happened over time with the current quality tools is we've taken an additive approach to how we display data on the legacy tools. And over time, as we've added measures, this can become quite cumbersome. So we've done some basic exhaustive research on finding out what's the most important things for beneficiaries to help them make decisions around their compare needs. And we've designed Care Compare to meet those needs. We've provided an intuitive search, the ability to do side-by-side comparison. We're basically empowering patients and families to find the best care for themselves. And really what we're trying to do here is provide a framework that we can kind of continually involve these tools and hear feedback from beneficiaries, caregivers, and stakeholders so that we can keep improving this and do that rapidly. So next slide, and actually I think this is where I believe I'm going to need share rights, and I'm going to give you guys a little demo. Okay, so right now, what you should be seeing is the landing page for Care Compare. Just talking a little bit through the anatomy of the page, you have a hero image that has a call to action about finding and comparing different types of providers. You have a location, which if a user chooses, it will automatically fill that based on your browser's location. You are also able in this area to type in a city, state, and zip. Next, you are putting in your provider type. Just for the demo, I'll go ahead and put doctors and clinicians. And then in the area where you don't have to, it's optional, but you can specify a specialty, a provider name, or group. So I'll go ahead and pick orthopedic surgeon, but as you can see, it can autofill a bunch of different options. Let me go back because I didn't mean to hit send there. So then you can hit search and you'll get taken to the results page. Based on our research and even our early analytics that are coming in from September, this is how most people will navigate the site. But in the event that folks need to learn more about the different settings or want to know the different settings, there is an area down here where you can select a specific setting and learn a little bit about that setting and continue on through these modules. And then at the very bottom, we have tips and resources. For those who are familiar with quality tools, a lot of this information from where the Spotlight news or other information, you can find that down here. But for most beneficiaries, they're mostly interested in putting in a search and getting results back. The last thing I want to call your attention to is this What's New section. There's also information in this area that pops a tray to show additional information about the different data sets, information that might be important for different stakeholders to know. But again, what we've really tried to do is for that 95% of our users who want to get in, find a provider in their area and compare those, we've cleaned up significantly to do that. So I'm going to go ahead and hit search. Remember, I'm searching on doctors and clinicians. Now you're looking at a search results page. You'll notice right away that what was on the landing page, your location, provider type, and optional, stays with there. This is so folks can bounce around if they want to change their provider. This will stay consistent regardless of where you're at. The next area is a filter tray, and this will change depending on what setting. Because different settings are users, there are different filters that are important. Most of them will have a distance range where you can change the distance. In this case, we've defaulted to 10 miles because it's in Baltimore, which is, but if we're in a more rural area, we may blow that default distance out. You'll notice on the left side, you'll have our results card. And in this area is where we focus the most important information that a beneficiary might need or that we've heard through research that is most important to them. You also have the ability to compare up to 3 providers, or add them to your favorites if you're logged in. This is a feature that for a lot of our My Medicare users is important to folks. They'll add their favorites, and that's something that they can use in on the login experience of Medicare.gov. There's also a print feature up here on the top right, and more results. You can also use the map function where you can zoom in and out. We seem to have a large group of providers here for orthopedic surgeons in Baltimore, but you can click on the different marks and find, and it'll navigate the right side of the results to that area. One thing that was really important to us is, regardless of what setting, and I will show like a nursing home setting next, but we wanted to make sure that the user interface was the same regardless. While the data might change, the user interface is the same. This helps with people not having to relearn. The other thing that we felt was important and that we found in testing was people oftentimes needed help with the next step. What do I do next? Okay, I found an orthopedic surgeon. And we've added additional information that will help a beneficiary know kind of what are those next steps they can take. Go ahead and just for purposes of the demo, I'm going to go ahead and change. So let's go ahead and look at nursing homes, and we'll pick. You'll see as I type it, you could also have done a zip code, but you can search city, state, or zip, and it will update my results. So now what we're looking at is nursing homes in a specific area, in this case, Catonsville, Maryland. We are sorting by closest, but you can change your sort to highest rated. You'll notice the filters have now changed. There's even more filters hidden behind more filters. And you're able to search the different nursing homes in this respective area. I've went ahead and hit compare. I'm going to go ahead and compare 3 nursing homes in this area. So you hit the compare feature. Now what you're looking at is a side-by-side comparison of these 3 nursing homes. And again, we've been very careful about not adding too much noise to the Care Compare experience. These decisions are very tough for our beneficiaries, and so it was really important to us to give very good scannability of the information that they would use to make a decision about choosing something like a nursing home. And you'll notice, so we've chosen to show this information side by side, so it's very easy. The names of the nursing homes are at the top right and kind of stick to the top. And then we have additional information in accordions that users can open if they want to drill down into other areas. Go ahead and hit back. And that is essentially the Care Compare experience. Finally, you can go to a details page. I just showed the Care Compare, or the compare page. And now what I'm showing is the details page, which is where you can find every piece of information that we have related to that nursing home, and where you can drill really deep on this information. In this case, I'm looking at health inspections, and you can look at full reports. Again, we haven't taken away any data that was on the legacy quality tools. We've just reorganized it to make it easier to use for beneficiaries and those who help them. But again, you can navigate through all the information that we have. You could and review that information. This concludes the demo portion, and I don't know how much time I have, but I'm happy to take some questions if folks have any, and I will go ahead and stop sharing.
Thanks, Nathaniel. Yeah, I think we do have a couple minutes here for questions, so I just want to remind folks that you can ask them either in the Q&A box or in the chat feature. We do have a couple questions that we got preemptively via email that I can go through while we're waiting for folks to gather their thoughts online. So I think one of the questions is, how does the Care Compare team determine which measures to show on the website?
I'm not sure who we have on from CMCS, but one thing to say is right now we show all the quality measures that were on the legacy quality tools on Care Compare. It was very important that we, from a data perspective, we don't lose any data. Now, we have chosen to organize that data differently, and we've also done a lot of user research on specific measures, the labeling, and how best to show that information so that a beneficiary may understand it. But as far as what goes up, that is typically something my CMCS colleagues, CCSQ colleagues would have to answer more detail.
Great, thank you. We got another question in the Q&A feature. How do you add several specialties in one query?
Yeah, I don't think, so right now, when you go back to the landing page and you put in a search, right now we search on one specialty. So if you're looking for a specific doctor, we are only going one level deep from a specialty perspective, and not necessarily saying, find me a doctor that is in both these. But that is an interesting concept that we may be looking to explore if someone's looking for two different types of doctors or clinicians, allowing them to kind of add multiple in the same results. But at this point, you would basically, and we've made it easy, but you would go to the top of the Care Compare experience and just put in that other specialty, and it would show you a new result.
Thanks. We actually got a follow-up on that question, which is, what about in situations where you're looking, for example, for like family medicine, internal medicine, and general medicine, where the specialties are maybe sort of related? Is there a way to consolidate all of those, or are they grouped together, or would you have to do those separately?
Right now, those are all grouped together. We do have a pretty sophisticated taxonomy behind the scenes that does return results. For instance, if you put in general practice, you will get specialties for like internal medicine. And we do have a kind of we do make some smart decisions about grouping like specialties, because we have seen that users may not know exactly what the right search is. So we do make some allotment for that, and specifically the one that was just referenced for like internal medicine or general practice or family practice. Those often do return similar results. And then in the card, we mentioned the actual if somebody has multiple specialties, for instance, if a doctor has both internal medicine and general practice, we show that on the results card.
Great, thank you. Okay, we actually got quite a few questions, so let me scroll. Thank you. So Eric Clark, thanks you for this presentation. Regarding the PDC, do you know when that's planned to go live, and can you confirm that legacy data will also be migrated?
Yeah, PDC is live. I'm sorry. Yeah, both Care Compare in the Provider Data Catalog, or PDC, went live in early September, and so you can go there now. I don't know if it'll let me, but I can put in the URL right here, because I know it's probably hard to. I guess I can't. If there's a way to do that, I can. It's data.cms.gov/provider-data. Thanks.
And yeah, Nathaniel, if you want to just, like in the middle of this call, you can email that to us, and then our team can put that in the chat feature for everybody.
But both these tools are live now. There are ways to give feedback on both tools. We're running these side by side with the legacy tools until the end of the year before we sunset the legacy tools and data.medicare.gov, for the exact reason of kind of collecting feedback to make sure that while beneficiaries are our main goal, we want to hear from everybody to make sure if you see a bug, if you're looking for a piece of data, we're making sure that we've done all that. But all the data that was on data.medicare.gov is on PDC. All the data that was on the legacy quality tools is on Care Compare.
Thank you. Another question is, do beneficiaries have the ability to look up physician outcomes, such as adverse events, infection rates, for example, with orthopedic procedures?
I wish I had my SME on physician right now available. We do have outcome. So anything that was on the physician compare, legacy physician compare tool, if we have those measures, which we would have them over on Care Compare. But if it's something that wasn't on the physician compare tool, it would not be on Care Compare at this point. I know there's a whole bunch of measures that we're adding very soon that as part of 2019 data. And so I don't know if that's part of that, and I apologize. We may have to get that your name and kind of email you back on specifics around measures going up in the physician setting.
Fantastic. Okay. We also got another question about like the risk adjustment of the tools. Is that something that you can speak to, or is that something that we should follow up on?
I'm not the right guy. I should have introduced myself. I'm the director of web development. That question should kind of be sent to CCSQ if it's around risk adjustment and kind of the methodology or models. I can just tell you whatever the methodologies and model for these measures has not changed. We really, this is a front end user experience tool change, not a how we collect the data, how the cadence of the data, or the methodology behind how the measures are adjusted. And
awesome. Thank you. And yeah, so for the folks on the line that are asking more technical questions about the data that's available on the site on the back end, we can certainly follow up with you. We have your names from the Q&A, so we can follow up with you by email when we get that more detailed response. So with that, I think I am going to transition us over to our next topic. Or did you have any more that you wanted to talk about, Nathaniel?
No, I think that's it. I mean, I see the timeline slide up, and that is the last one. But just to mention, we started this project a while back. We actually started earlier in January, but we announced it to the public, almost a year ago. And we went through a lot of stakeholder feedback. We were at the quality conference. We've conducted sessions with many different stakeholder groups, advocacy groups, professional industry groups, and most importantly, I think probably a dozen at this point, rounds of research with beneficiaries and caregivers. We launched this in September, and just as a reminder, we are retiring the original 8 compare tools by the end of this year. So if you haven't had a chance to kind of acclimate yourself or get comfortable with the new tools, I suggest for those who need these tools or need to communicate out this information, it's important to do so. That's it. Thanks, everyone.
Thank you so much. All right, so before we jump into Blueprint, I'm going to open it to Kim Rawlings, who's incidentally our presenter for the Blueprint, but just to follow up on some of the things from the previous topic.
Okay, great. So just wanted a quick update. As you know, things at CMS are always moving quickly, et cetera. And so we did actually, or we're in the process of making some announcements this week, I think a couple of which have actually gone out today, that we are actually sunsetting the legacy compare sites December 1st. And so that's kind of late breaking news that, like I said, you'll be hearing through various listservs, et cetera, in the coming days. But you were able to join our webinar, and so you get to hear that late-breaking information today. And, it's just important to have one source of truth, one source of the data, make sure it's kept up to date. And so we decided to try and sunset those sites as early as possible. So I just wanted to add that plug there. All right, I will transition myself then right into the blueprint for the CMS Measures Management System. As Brenna said, my name is Kim Rawlings, and I'm the lead for the MMS Blueprint, along with the entire Measures Management System with the inventory and everything. And when we think about the measures management system, I really like to think of it as a system that helps to standardize measure development across CMS, encourage and really support innovation in measure development, all while bringing transparency to the measure development process so that stakeholders and others can really get involved in the development of measures and their implementation and provide us feedback. And I think the blueprint is really foundational to that and really embodies those three, I guess, like principles in the sense of, it's a large, was large, now it's shorter, which we'll get into, but it's a document that really talks about how do you develop a measure from the very start to the end and do it in such a way that produces a high-quality measure that's ready to be implemented into a national program. We try our best to bring in a lot of best practices from across the industry and from across various measure developers, and I think you see that a lot, especially when we talk about patient engagement. And then lastly, around transparency, we love for folks that are not measure developers to read the blueprint and know what we're doing and how we're doing it and find places to get themselves involved. And I think the changes that we are outlining today and the redesign that we've gone through with the latest version of the blueprint is really going to help us increase transparency by making the document a bit more accessible to all. So if you go to the next slide. So today we're just going to talk very quickly. I'll talk a little bit about the rationale for the redesign of the blueprint, and then I'm going to pass it on to Jennifer Brustrom from Battelle, who's going to run through what constitutes the package now, and she'll talk a little bit about the streamlined blueprint, walk through some changes that have happened to the content of the streamlined blueprint, as well as the templates and supplemental materials. And we'll clarify all of this and what this means in a few moments. And then we'll take any questions and get any feedback that you all have as well. So traditionally, and I'm going to steal, I think, a little bit of Jennifer's thunder here, but traditionally the blueprint has always been for our CMS measure, CMS-funded measure developers, for our contractors. And in the last couple of years, we've really gotten an increasing amount of feedback from stakeholders that they're interested in using the blueprint too, that they look to it as a guide for what they're doing, especially if they're looking to put a quality measure into a CMS program. We've also heard that it's too long. I think at one point we reached 500 pages for the blueprint. I think over the last couple of years we might have gotten that down a little closer to 400, but 400 can still be pretty overwhelming. And so in an effort to really increase accessibility, increase transparency, et cetera, it was really important that we redesign the blueprint to make it easier for people to find information, to make it easier for people to realize how a measure is developed, what's the process, and not get sidetracked or get distracted by a lot of the contractual language that was in the blueprint. And so we've, kind of broken some things out and really created a blueprint package that hopefully will be more accessible, more readable, and really allow the user to more easily decide what parts are important to them. That way they can kind of tailor their reading to what they're specifically interested in. And so with that, I'm going to turn it over to Jennifer, who's going to talk about what is the blueprint package now and what's constituted in it.
Great. Thanks, Kim. Can you hear me okay?
Yep.
Perfect. All right. As Kim mentioned, the blueprint is now a package. It encompasses 37 documents, nearly all of which are available to the public on the CMS Measures Management System website. The streamlined MMS blueprint describes the basic steps needed to complete the measure lifecycle. It begins with a preface that describes how the blueprint has evolved over time and provides an overview of all blueprint material. The next 3 chapters provide an overview of CMS quality measure development, measure prioritization and planning processes, and quality measurement. The streamlined blueprint includes individual chapters dedicated to each of the 5 stages of measure development: conceptualization, specification, testing, implementation, and measure use, continuing evaluation, and maintenance. The final chapter of the blueprint provides a description of tools and resources for measure developers, such as the CMS Measures Inventory Tool, or CMIT, and the Environmental Scanning Support Tool, or ESST. Moving on to the supplemental materials, those are a set of 16 standalone PDF documents that are inclusive of a glossary and acronyms definition document. Each of those documents addresses a different measure development topic in depth. Examples of topics covered in supplemental materials include electronic clinical quality measures, or ECQM, person and family engagement in measure development, technical expert panels, measure calculations, and codes, code systems, and value sets, as well as environmental stands. The blueprint package also includes a set of 15 templates designed to guide measure developers through measure development processes, including, for example, the processes for planning and conducting technical expert panels, developing a business case, and developing an information gathering report. Designed with both experienced and novice measure developers in mind, the CMS MMS Blueprint Quick Start Guide provides a start-to-finish overview of measure development, implementation, and maintenance steps and processes. Each section includes information about important steps associated with a given stage of the measure lifecycle, along with links to additional resources, templates, and references to specific chapters and supplemental materials of the blueprint. A new resource, Quality Measures, How They Are Developed, Used, and Maintained, or Quality Measurement 101, provides introductory level information about quality measures, and you'll be hearing more about that resource in the next presentation. Finally, the MMS Blueprint Contractual Edition and Contractual Edition Task Lists are the final component of the Blueprint package. These resources provide additional contractual information that is specific to measure and instrument development and support measure developers and their contracting officers' representatives, or CORs. MIDS measure developers and CMS staff who have a CMIT account can access these documents in the MIDS Library Resource Center. The streamlined blueprint, things that are new for this version include an updated preface that describes the current format of the blueprint as a package of materials, whereas previously all blueprint materials were contained in a single volume, as Kim mentioned before. The blueprint team updated graphics across the set of blueprint documents and added a new stakeholder engagement graphic in this version. The team also added an introduction to structure, process, outcome, also known as the Donabedian model. And we also expanded the list of roles in the measure development section to include measured entities and other stakeholders, such as persons and family members and the public. We also added a table summarizing definitions for different measure types and the source of those definitions. The blueprint now contains references to the Measure Collaboration Workspace within the ECQI Resource Center, which is a 4-module resource available to assist clinicians, ECQM developers, implementers, and submitters throughout the ECQM lifecycle. The team added a section on special considerations for Medicaid-focused measures, including details such as the fact that states vary in the collection, analytics, and presentation of data for Medicaid-focused measures, as well as the detail that federal Medicaid data reporting is voluntary, not mandatory. Another structural difference from the previous iteration of the blueprint is that the measure evaluation chapter has been removed and incorporated into the measure testing chapter. As I mentioned earlier, the blueprint now contains a section describing tools and resources available to measure developers. An example would be Bonnie, which is a software tool that allows ECQM developers to pre-test their measures efficiently. The blueprint templates for this iteration of the blueprint also reflect several organizational and content changes. All templates are now available only as standalone Word documents. Previously, the templates and instructions for the business case, measure information form, and measure justification form were separate documents, and now the templates and instructions for each of those have been combined. Public-facing documents were streamlined to reduce the need for scrolling when readers view them on a screen of a computer or other electronic device. And the environmental scan template was renamed the Information Gathering Report template to better reflect the template contents, which provide guidance on developing an information gathering report in its entirety. The 16 supplemental materials are standalone PDF documents, each with its own table of contents and reference list, as well as a section summarizing the key points of the material. Our team made substantial revisions to the content we provide on the topic of ECQMs. For example, we added a section on emerging standards, such as Fast Healthcare Interoperability Resources, or FHIR. We also updated several of the graphics and made updates to the section on annual updates. All of the information about special measure types were consolidated into individual documents, with one document dedicated to each measure type, including cost and resource use measures, multiple chronic condition measures, patient-reported outcome measures, and composite measures. Additional new features in version 16 include the provision of glossary term definitions in activated hoverovers, and the team also added hyperlinks linking the main blueprint document and the various templates and supplemental materials. Finally, the Blueprint Contractual Edition includes contractual information and new task lists to assist MIDS measure developers and their cores with ensuring that they complete all contractually required steps. At this time, do we have time for questions at this point, Brenna, or would you like to hold this till the end?
We definitely have some time right now, so let's go ahead and pause so that folks can ask questions. As with before, we do have some preliminary questions that came in through email, so I'll run through those while the audience gathers their thoughts. And again, as a reminder, you can raise your questions in the chat feature or in the Q&A feature. So Jennifer, can you tell us, are there any plans to add new supplemental materials in future versions of the blueprint?
Yeah, sure. Thanks for the question. Yes, we are currently developing a new supplemental material on population health that will be released with version 17 in September 2021, and it contains background information about approaches to population health improvement, as well as considerations for developing, evaluating, and maintaining population health measures. Another possible topic we're considering developing a material on, not for version 17, but possibly for the future, is telemedicine. We are very open to suggestions, so if anyone in this group has ideas about topics that would be valuable to have resources describing, we would love your suggestions, and you can either forward those through the chat or through email at mmssupport@battelle.org.
Okay, thank you, Jennifer. One other question is, how would you recommend navigating the blueprint for someone looking to develop quality improvement measures as opposed to measures for use in accountability programs?
Okay, I think I'm going to turn that to Kim.
Thanks, Brenna, for the question. Thanks, Jennifer. So, I think that we, especially with this latest edition of the blueprint, like Jennifer was saying, we do our best to create materials so that they don't include a lot of CMS contract-specific language. And like I said, like we said, in fact, with this version, all of it has been taken out. And contractors have a different resource that they can utilize to gain some of that information. And, all of that is to just try and make them more applicable and accessible for general use. That being said, the standardized development and evaluation requirements that are laid out in the blueprint are really represented with quality measurement in mind. That's not to say that it's not applicable to quality improvement developers, but for measures being developed for use in one specific care setting, you really have to have a bit more leniency in how you approach this. So I would say that you could definitely use these tools as kind of guideposts for your development and testing, and then kind of modify on an as-needed basis, depending on your specific goals and budget and bandwidth.
Great, thank you, Kim. All right. Well, I don't see any other questions in the Q&A feature. So with these last 15 minutes, I just want to turn quickly to a new resource that's been posted to the website. So Amanda, if you could jump to the next slide. Great. Thank you. That's perfect. So QM 101, that's actually sort of an informal name. It's really the quality measures, how they are developed, used, and maintained document. And, the idea is that this is meant to be a very sort of glossy, easy to digest overview of the measure development process. It's intended for people that have maybe some familiarity with measures, but aren't at the level where they're following the blueprint to develop one of their own. It's really meant to provide some context around the work that we do in measurement. So Amanda, would you mind just making me give me the ball really quick so I can share my screen? Okay, so this is the document. I just wanted to quickly show you where you can find that. So when you do what I do, which is I just Google CMS MMS blueprint, it takes me to this page on the MMS website. So everything that Kim and Jennifer just described, you can find here. This is where you can download the blueprint itself. All of the supplemental materials and templates are shown here, all in one place. And then this Quality Measures 101 document is linked right here. So to save us from freezing, I already pulled it up. So this is what that document looks like. And, we have this how to use this guide, but, as I said, it's really just intended to provide information kind of about two things. Like the first is to explain the complexity of the quality measure development process, to kind of help people understand, how measures are developed, how they're tested, and why that process takes so long. And then also kind of describing the context around the role that measures play in helping the healthcare system improve quality of care. And you'll see that, the report is designed to be read, start to finish, but we did build in a lot of navigation features, a clickable table of contents menu, a return to main menu button at the end of each section, and then text links throughout to external web pages to help you find what you need. So we really tried our best to make this something that's, kind of enjoyable to look at, to dive into a relatively complex topic. So I'm not going to walk through the entire document, but I did just want to show you, a little piece just to give you a sense for the feel of this document and the types of resources that we included. So we have this About Quality Measures page. It just gives you, a little narrative description of the elements of a quality measure. And then on the next page here, what you see is, based on that description, here is sort of an illustrative example of that measure shown as a formula. And then that same measure reflected below it in a way that people, I think, are used to seeing quality measures. So where you hear, the description, which is just what this measure actually is, the percentage of patients 18 to 85 who had a diagnosis of high blood pressure and whose blood pressure was adequately controlled during a given measurement period. It breaks down the numerator, which is also reflected up here, the exclusions, which are the pieces that are subtracted, and then the denominator itself, which is right here, and that's what your measure score is. What I think is really helpful about this guide is, in addition to, showing information in a digestible way, there's also these links, right? So for this measure, if you wanted to learn more about this exact measure, you could actually click here, which I've already done preemptively, and it takes you to the CMS measures inventory tool, and it opens up to the page for that exact measure. So if you wanted to know more about the measure that we were using as an example, to understand more about how these things are structured, you could go here and then see all of the information about that measure. And this whole guide is filled with examples of items like that. So, you know, if you want to find the list of quality measures that CMS uses, it takes you directly to the home page of the CMS measures inventory tool. Here, when we talk about different types of quality measures, we link to specific measures that meet each type. So if you're looking for an example of an outcome measure compared to a patient-reported outcome measure, you could do that straight from this tool. And so our hope is that you'll find this to be you know, a helpful resource to share with members from your teams or your colleagues who want to know a little bit more about what quality measurement is and how it fits into the bigger picture of healthcare delivery and quality of care, you know, without asking them to dive into the whole blueprint to do so. All right, so with that, I'm just going to jump to the next slide here. So I just wanted to give you some key points of contact here. Jennifer mentioned earlier, if you have any feedback about the blueprint or about Quality Measures 101, you can always email us at mmssupport@battelle.org. You can also feel free to follow up with us here if you have any other questions about the things that we presented today, suggestions for future webinars, or if you just want to get in touch with the MMS team for any reason. Again, I'm Brenna Rabel. This is my contact information if you ever want to reach out to the stakeholder team here on the MMS contract, and then you can also reach out to our core, Kim Rawlings. Kim, I did want to give you a quick moment to just touch on this. I think you talked about this a little bit earlier, but if you wanted to just highlight any of the resources that are listed here, I think that'd be great.
Thanks, Brenna. Yeah, I mean, I think that, you know, we just rolled out this, the resource recently. I'm forgetting the exact launch date, but I want to say it was late August with the early September with the Compare site. And so, you know, feel free to take a look at some of the resources and videos and blogs, et cetera, that we've had to advertise the site. And I know that there were a handful of questions about the provider data catalog, and so these might be a great resource as well. Thanks.
Thanks, Kim. All right. So with that, we've reached the end. I do just want to give everybody a couple of moments if you have any questions, but I don't see any in the chat feature. So, you know, just as I'm wrapping up here, if you have any questions, I will ask them of the group. But again, thank you so much for your attendance today. We've really enjoyed being able to share these updated tools with you. Again, if you have suggestions for future webinars or if there are just general topics that you'd like to see more information about, please do reach out to us at mmssupport@battelle.org, and we will gladly take that under consideration. So with that, I'm going to wrap us up for the day. So thank you again, everyone, and we look forward to talking with you again in January. Bye, everybody.